If you're a runner or hybrid athlete out there and have been suffering from low back pain that hasn't been getting any better, this video is for you. I'm Dr. Jerry Yu, founder of Next Level Physio. And on today's episode, I specifically want to talk about the SI joint, otherwise known as sacroiliac joint pain. And the reason I bring this up is because this is probably the most common type of low back pain that we treat in runners and hybrid athletes, but it's often the most misdiagnosed area or undiagnosed area that gets missed by many providers out there. And I'm not really sure why. For me, it seems obvious, but it is what it is. So we're going to talk about this. I want you to be able to identify this so that when you go see your healthcare provider about the kind of back pain you've been having, and it happens to be SI joint pain, I want you to be able to clearly articulate where that pain is so that your healthcare provider can be better in tune with what to do next. So we got to show you where that is so that you have a clue yourself. Now, if you take a look at this model, this is a model of the sacrum, which is the lowest part of your spine. Obviously, the coccyx, which is the tailbone, is below that. And on either side of the sacrum, you have two pelvic bones. In Latin, you would say ilia, which is what refers to the pelvic bones, which means wings. They kind of look like wings, I guess. You can see that if I'm walking, how there's some relative movement between those two segments, like so. And sometimes that area gets very irritated. Now, there are many reasons why that might be, and there's still an argument for why would we even look at the SI joint if it's a joint that really doesn't move very much. It's basically millimeters of movement. And the way that I look at it is that, well, if you have something that moves millimeters, and for some reason, maybe because of trauma, stress, leg length discrepancy, or something else, maybe that is enough to cause the SI joint to be really irritated because it doesn't really move. So if you move beyond what its normal range is, which is only a couple of degrees, maybe that's what causes this pain to happen. That being said, if you sort of like feel your back under your pant line in the center, that's where your sacrum is, and on either side is going to be where the pelvic bones are. So if you can clearly identify that area to your provider, that might help your provider be able to make a better decision about what to do next. Now, what you have to rule out, and what a lot of providers will have to rule out, is the bad stuff. So that might be a disc herniation, that might be fracture, which is really uncommon in that area unless you had a bad fall. Things of this nature, maybe an irritated nerve root on that area. There are a lot of things that run through that area, ligaments, tendons, muscles, that you need to identify to make sure that what you're looking at is truly an SI joint problem. Now, once that's been done, we can move on to what other symptoms you might have. So you might have focal pain or localized pain to this area on either side, sometimes both sides, sometimes in the center. I have found from my own personal experience, having had this for many years before I had this treated by one of my colleagues, that sometimes the pain I was having would actually wrap around the side of the hip, almost radiating towards the front and even a little bit into the hip flexor and groin. And I think if you're not a provider, it can be kind of confusing about what you're feeling. You might be feeling like, oh, it's a nerve thing because it's wrapping around, but really it's just referred pain coming from that area to the front and other muscles possibly coming in to compensate for any irritation there might be at that SI joint. I would even get pain up the spine as far as the multifidi and where the lumbar paraspinals go. And those are muscles, big muscles that come on either side of the spine. So everyone presents differently, but those are the things that I felt when I was dealing with this. And it's funny because I would do a couple things to quote unquote put it into place and my pain would instantly disappear. So I can tell you from experience that this can be really painful and often missed because of how those symptoms can present. Now, why do I think this happens often in runners, or why do we see this in runners very often? I think a lot of the time, if you take a look at the typical posture for a runner when they're not running, they still kind of have a forward lean to their posture, which means that they're kind of moving forward. And it kind of makes sense when you're a runner that you're always moving forward, that you might look that way even when you're not running. And that is something very common that I see. The second common posture that I see is something called sway back posture, which is basically when the lower part of your spine is sort of forward and your mid back is in sort of the same place. So you have half of you forward and half of you in the same place. It almost looks like you have a belly here, but it's really just the positioning of the pelvis, where the rib cage is no longer directly above the pelvic diaphragm, which forms a nice sort of like stacked position, as my friend Zach will call it. So as a result, you're getting a lot of compression in your lumbar spine into extension. And with enough compression in that area, sometimes that can irritate the areas below. So I found that when I was having this issue, and I do have a sway back, by the way, When I was able to decompress my lumbar spine by going into more of a neutral position, more of a stacked position, where the rib cage and the pelvic diaphragms were more aligned, my pain was also mitigated. And so that might be something that you should look into as far as having your provider look into how much of a stack you have. Are you in a sway back position? Are you more of a forward leaner, even when you're standing and when you're not running? You want to rule these things out and address those things, which will be helpful. Second thing you want to do is see how even or level those bones are. And yes, there's an argument that we're all kind of uneven and all asymmetrical. I know that. But I've seen commonly that people who have SI joint issues do have some sort of discrepancy in the heights of their bones. So what I mean by that is, and I'm exaggerating here, so just know that you might see a bit of this, where one of the portions of the pelvis is a little bit higher than the other. Contrarily, from the front, and looking at these two reference points here, one of these guys might be up or down as well. And what I have found from my experience is that when we correct those things with a couple easy techniques that people can do at home, it does help to resolve issues and pain symptoms that are coming from that area. And then it becomes a matter of how do we stabilize that for the long run so this person has a long-term outcome that doesn't irritate the SI joint moving forward. Now, how do we fix this? Well, there are a couple of things that we do in the phase 1 part of our program at Next Level, and that is using things like regenerative modalities. And that might be dry needling with electricity. It might also include the shockwave to the SI joint area, and particularly to the lumbar paraspinals, which again are muscles that are on either side of the spine, and even to the glutes, depending on what's going on over there. But we have found that using that approach, along with a very specific program to, again, either decompress the lumbar spine or to get things more stable by setting the muscles using certain techniques, have been helpful in mitigating many of our symptoms that we find in SI joints related issues. So again, in our next video, we're going to talk about those specific strategies that we have found to be effective. Again, if you are suffering from SI joint pain, at least after this video, you know where it's located, you know how the symptoms might present themselves, you know how to identify it on yourself so that you can better inform your provider. And in our next video, we're going to talk about how we can treat this effectively, and hopefully that'll help you also on your journey getting back to running or whatever it is that you love to do. Having said that, listen, leave a comment below. Tell us how you have dealt with back pain in the past, what things, and if you know that you have an SI joint issue or had one, how did you deal with it? What kind of help did you get? And let's share that knowledge with other people who are also trying to find solutions to getting rid of their SI joint pain forever.